thank you for joining us. This is Mountain Health Today, and I'm Ted Owens, your host. This program is brought to you by the Tahoe Forest Health System and is built around your well-being and health. Today we'll be talking with President and CEO of the Tahoe Forest Health System, Mr. Harry Weiss, and our topic today is the COVID vaccine. Harry, welcome.
Thank you, Ted. Happy to spend time with you.
Good to have you here. So we're going to provide a little bit of an update, but let's talk a little bit about the status of the COVID vaccine or vaccines and where we're currently at with vaccines in our community.
Sure. I think first of all, as a background comment, COVID-19 is still happening out there. Fortunately, in our local region, it's at a very low volume. But as we look across America, there's over 50,000 new positive cases per day. So this pandemic is not over yet. Let's not let our guard down yet. This vaccine rollout is continuing to expand every week now with a very strong hope that anyone who wants to be vaccinated can be vaccinated in the next several months.
Harry, the Tahoe Forest Health System has been issuing vaccine inoculations in the North Lake Tahoe area, both in Incline and in Truckee, correct?
That is correct. We're pleased. We started back in December of 2020 and did the people groups that the state and the counties allowed us to, and we've continued to expand that each week. The vaccine quantities have been scarce, but we have very good news that the quantities are increasing, and we do expect that those vaccine quantities will increase markedly even in the next few weeks, and hopefully allow us to execute a major sprint over the next 2 to 3 months as an estimate.
And to be clear, the health system has been working in collaboration with 3 counties essentially, and each county's been doing it a little differently. So we've been working for the health system, or the public health system of Placer, Nevada, and Washoe County. So has that added some confusion as the rollout happened?
It certainly adds to the complexity. Many patients might expect that we're totally in control of who we can vaccinate, and if they would desire it, regardless of age or health status. Some would like to have it right now, and so we've had to really respectfully offer that we're not in charge. We're only allowed to do the people groups that our counties and the state allows.
Now, you were very proactive right from the get-go. I'd like you to share a little bit about what your team did and how quickly they did it, from building a testing site originally in the COVID era.
I'm really proud of our team. I provided a big green light to our healthcare team to really execute as the largest possible public health effort. And so back in March of last year, 2020, for those of you who recall, we had a big snowstorm during that period, and we had a lot of visitors. And our team, in the midst of a snowstorm, built several shelters so that we could establish a drive-up COVID-19 testing center. We developed a hotline phone number, which is still alive today, 582-3450, area code 530, with about a 6-day-a-week registered nurse hotline. But that all happened in the middle of a snowstorm. We immediately started testing. We worked vigorously to provide the COVID-19 lab tests. Getting the reagents was extremely difficult. So we had to work through multiple vendors to work that out. But just to show you an example of the courage of our team, they're out there in that cold weather, and so they have creatively found devices to keep their feet warm and their hands warm, and coats and so forth, because as we all know, in Incline Village and in Truckee, it can be really cold. And so we have a very brave, courageous team that loves our community.
So the evidence shows that your team jumped in very proactively in the beginning with respect to testing and has duplicated that effort with the issuance of vaccines within the community. And we're going to talk a little bit more about that, but you had made a point to me before we were on the air. Please don't call your physician to get a vaccine appointment. Why don't you share with us why that is?
That is correct. Our physicians are not in charge with a patient's ability to receive the vaccine. You do have to watch our respective counties' websites, or you can watch and monitor tfhd.com website. And in California, there's a My Turn software application that will advise you. So those are the ways that you can find out how quickly you might still be able to get a vaccine.
Perfect. Harry, we're going to take a break. For the folks at home, you're watching Mountain Health Today. We're talking to Harry Weiss from the Tahoe Forest Health System about COVID and the vaccines. We'll be back in just a moment. Welcome back to Mountain Health Today. I'm Ted Owens, talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, and we're talking about the status of COVID, both testing and the vaccine. Harry, let's talk a little bit more about testing really quickly. How does one obtain a test in the clinic that you built?
We have a drive-by clinic, and it's really focused. If anyone calls our registered nurse hotline, which is 582-3450, and speaks to one of our nurses, they will refer you, if applicable, to our drive-up clinic. And we have a variety of lab testing pieces of equipment. We now have invested in 3 technologies, 2 of which are not in about 20 minutes, so they take a little bit longer, but they're very high precision tests that are available for our public. One of the testing pieces of equipment tests for over 20 different illnesses, including flu and pneumonia and COVID and other things. So it really helps our physicians rule out exactly what's going on. And so our RN hotline will help you to get to our site if needed. But we're also happy to share that in our community, over in the old Gateway Center, that's the name on the building, it's 10990 Donner Pass Road here in Truckee, across the street from Tahoe Forest Hospital. You can schedule for free COVID-19 tests there. They have an 800 number you could call. It's run by OptumServe, a contract with the state. Their phone number is 888-634-1123, or their website is ihi.care/COVID testing. And so that's a great option for people in our community as well.
Harry, you and your team were very proactive from the very beginning with the construction of those drive-up testing facilities, all the way moving through where we are today with respect to vaccines. As the COVID era progressed through the past year, can you share with us a little bit of the inside skinny on its impact on the team? This is something that the public may not really be readily aware of. How did it impact the folks that care for the community?
I think it's very important for the public to know that here is a disease that physicians and other clinicians around the world knew very little about. And there weren't well-established medications or treatment processes as to how to quickly treat this disease. And so the stress by physicians and others all across America, around the world, and locally was enormous as they were learning, as they were sharing, what works and what wasn't working with the treatment of these patients. And, a small percentage of COVID-19 patients were very ill, but when they were ill, they were really ill. And our great clinical team here saw over 400 admissions that they tested for COVID-19 and or treated. And they really did an amazing job in terms of how quickly they adapted the latest protocols for treatment. We had great outcomes nearly all the time, amazing outcomes. What was also interesting to see is effective treatment with far fewer usages of ventilator machines. That was a real tribute. And then our team became very proactive on early symptoms in an outpatient setting. For example, only one example of a treatment might be Regeneron's antibody infusion treatment. And Regeneron is a great company that really contributed to the stoppage of Ebola a few years ago. So we've brought the best technology and training to care for residents in our region.
Harry, in addition to that, we only have a little bit of time left. Let's share once again what can we do to stop the spread?
The real key is very simple. Number one, let's physically distance. Let's wear masks. And I'd say first and foremost, just as we've observed with polio or smallpox, about the only way to really stop those diseases was through effective vaccinations. So we really encourage you to learn about the quality, the safety of the vaccinations, and to consider getting it, and to consider getting those around you to encourage them to consider getting it.
Okay, thank you, Harry. And of course, wash your hands. My hands have never been cleaner than they have been in the past year.
Absolutely.
I have to tell you. We've been talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, about COVID and how not to spread. And we're going to get into the vaccines in detail in our next segment. Thank you for watching. We'll be back in a moment. Welcome back to Mountain Health Today. I'm Ted Owens, your host. Today we've been having a conversation with Harry Weiss, the President and CEO of the Tahoe Forest Health System, all around COVID and the vaccines and testing. Harry, let's talk about the vaccines. Your team was very proactive. You shared with us in the last segment in the very beginning with respect to testing. You built a drive-through testing structure and facility. You've been proactive in other ways. And as the vaccines began to roll out, you were once again being very proactive. Share with us what you did with respect to the need for those refrigeration units that were required for some of these vaccines in the early days.
As soon as we learned on the clinical trials, for example, Pfizer, Moderna, et cetera, that there might be a super cold or super freeze requirement to preserve the vaccines based on our commitment to our community, we said no hurdle is too great for us to not find a yes solution to. And so we made sure we went out and started immediately looking to obtain those super cold freezers. We found that we had one because of our clinical trials and our great cancer treatment center. And then we proceeded to order additional freezers as well, because we thought these are going to be in really short supply. So we made sure that day one, we were probably the only provider around for maybe 30 or 40 miles or more that had the super cold freezing capabilities. And I'm not sure even how many of our counties had that super cold freezing capability. But
and Harry,
we
my
wanted to
understanding is that those machines actually sold out really quickly nationwide.
They really did, and I believe they're still in really short supply. And we have actually provided storage for other vaccine administrative groups in other distant areas who needed the vaccines but didn't have access to this type of cold storage. So we're a very sharing team.
Now, Harry, the vaccine rollout initially was a little slow, but how are the doses determined? Who determines what doses go where?
The federal government first defined, it looked at how many vaccines were being produced by the manufacturers. It was originally Pfizer and then Moderna. And then they looked at populations and demographics within of populations by state. And so they started allocating vaccines to each state based on a federal suggested quantity of vaccines. States would petition for more, obviously, but it all happened at the federal level. And these vaccines were being delivered around the world, not just to America. So these scarce manufacturers weren't exclusively delivering to America, and that certainly complicated things as well. So then the state gets the quantity, and then the state goes through a study of its counties and communities and demographics, and each state set up a slightly different tier system or people grouping system as to who was first priority, second priority, and third priority.
Harry, you have spoken repeatedly about the importance of the vaccine in stopping the spread of COVID-19, in addition to good practices. But many wonder is it safe? In your estimation, is it safe?
I do believe it's safe. I have read the technology behind it. I've listened to our physicians explain the technology, and it is tried and true technology, especially as it relates to Pfizer and Moderna's technology that's been around for more than 20 years. The thing I like about it is it quickly dissipates out of our body once it's done its required effect. And I cannot actually ever get COVID-19 from having the Pfizer or Moderna vaccine. I think that's encouraging. The technology used in some of the older vaccines that we've been familiar with for years, you could actually potentially get a case of the disease that you were trying to avoid with the vaccine. So we do have a variety of vaccines that are available. Johnson & Johnson, AstraZeneca. That vaccine is made more the traditional way, and it can be stored more easily. It's available to rural and in areas where cooling might be difficult to achieve. So we've got a variety of products to serve people around the world to help really stop this pandemic.
Thank you very much for being with us today, Harry. And I'm just going to repeat something I know you believe in. We don't want to get lulled into complacency here with the vaccine. So let's all continue to practice stop the spread practices, wash your hands, wear a mask, socially distance, and hopefully get your vaccine taken care of. We've been talking with Harry Weiss, President and CEO of the Tahoe Forest Health System today. Harry, thank you very much. And thank you all for joining us today. Greatly appreciated.